The building that became the field hospital had been standing empty for nearly 30 years when the task force arrived. A corrugated iron shell on the northwest coast of East Falkland, on the shore of San Carlos Water, a few miles from Port San Carlos. Built in the early 1950s by the Colonial Development Corporation to freeze mutton, shut down when the economics proved hopeless. It had processed around 14,000 sheep in its first year of operation, 16,000 in its second, then been declared unviable and left to rust. The prefabricated houses built around it were dismantled and carted to Stanley. What remained was the plant itself, low, grimy, corrugated, unlit, unheated, and, by the standards of what was coming, enormous. On the 21st of May 1982, British forces landed at San Carlos Water under Operation Sutton. Ajax Bay, codenamed Red Beach, was one of 3 landing points for 3 Commando Brigade. Among the first priorities ashore was medical infrastructure. The only roofed buildings large enough to house a surgical unit were here. Surgeon Commander Rick Jolly received less than 24 hours' notice to disembark from the troopship SS Canberra and establish a field hospital inside a derelict slaughterhouse with no mains water, no heating and no lighting beyond what his team could carry in. By the 22nd of May, the Advanced Surgical Centre at Ajax Bay was operational. It took 6 days for the Argentine Air Force to find it. On the 27th of May, A4 Skyhawk aircraft came in low over the British maintenance area around Ajax Bay and dropped multiple bombs. One detonated near the mess hall area of the complex, killing 5 Royal Marines of 45 Commando and the Commando Logistic Regiment, and wounding 26 more. 2 bombs fell wide into the sea. 2 of the remaining bombs tore through the corrugated roof of the hospital building and came to rest inside, close to the surgical area. They didn't explode. RAF bomb disposal teams examined both. The bombs were identified as SAMP 400 kg Argentine aerial ordnance, almost certainly dropped too low for the fusing sequence to arm. Removing them safely was deemed impossible. After consultation with Jolly, the decision was made to take no further action on extraction. The RAF BD team shored up the ceiling, built sandbag blast corridors around both weapons, and constructed blast walls between the bombs and the operating area. Jolly had calculated that if the weapons were time-fused, the maximum timer was around 37 hours. His team briefly evacuated the surgical area, waited, sandbagged, and returned to work, as casualties from the Battle of Goose Green began arriving. For the next 19 days, Surgeon Commander Rick Jolly's team operated in Arctic clothing, by torchlight, within range of Argentine aircraft that attacked the anchorage repeatedly, with 2 large Argentine bombs wedged into the structure above them. The Falklands War lasted 74 days in total. The one place in that entire campaign where British and Argentine wounded shared the same floor, under the same roof, treated by the same hands, was a disused mutton refrigeration plant at San Carlos. What happened inside it's the most creditable act either country performed in 1982. San Carlos Water had been chosen for the landings precisely because the surrounding hills restricted the attack angles available to Argentine fast jets, limiting how they could approach the anchorage. The logic held for ground combat. It didn't hold for the air war. Argentine pilots adapted to the terrain within hours of the landings. They came in low, below radar, below missile engagement envelopes, using the hillside contours as cover, and they hit ships. HMS Ardent was struck repeatedly in Grantham Sound on the 21st of May and sank. HMS Antelope was bombed on the 23rd of May. A Royal Engineers bomb disposal team attempted to defuse the unexploded device the following day. It detonated, killed Sergeant Jim Prescott, and the ship sank.
HMS Coventry, positioned too far out from the screening hills, was bombed on 25th of May and went down with 19 dead. HMS Antrim, HMS Argonaut and HMS Broadsword all took damage. The container ship Atlantic Conveyor was struck by an Exocet missile on 25th of May and sank. RAF bomb disposal recorded 36 air raid red warnings over San Carlos Sound in the week after the landings. British forces had started calling the anchorage Bomb Alley. The hospital at Ajax Bay was inside Bomb Alley throughout. Because the building sat immediately adjacent to a major British ammunition dump, Brigadier Julian Thompson had ordered that no red cross be painted on the roof. Under the Geneva Conventions, marking a structure co-located with legitimate military targets creates a deceptive protected symbol. The ruling was correct in law. It also meant Argentine pilots had no way to distinguish the hospital from the logistics complex around it, and no legal obligation to try. Jolly wasn't watching from shore while the anchorage burned. On 21st of May itself, while Argentine aircraft were still attacking the ships, he was airborne in a Wessex helicopter heading toward the damaged frigate HMS Argonaut to evacuate casualties. En route, the crew spotted survivors from HMS Ardent in Grantham Sound. The frigate was burning and men were in the water. One man was struggling and close to going under. Jolly had no immersion suit. He had his uniform, a thin life jacket and gloves. He went into the water anyway. The temperature was barely 2 degrees Celsius. He hauled the man up, was winched back into the helicopter cabin, and then the air crewman pointed down again. Second man. Both men survived. Later the same afternoon, Jolly flew 3 young Argentine conscripts to Canberra for surgical treatment. The JMVH obituary records what met them there. They had expected to be tortured and found it difficult to accept that they were being cared for with the same dedication as their foes. Those 3 were the first of nearly 200 Argentine patients he would treat. Richard Thaddeus Jolly was born in October 1946 in Hong Kong, the son of a Polish gunner in the colony's Volunteer Defence Corps who spent 5 years as a Japanese prisoner of war, and a mother who drove ambulances for the First Aid Nursing Yeomanry. He was educated at Stonyhurst College in Lancashire, then studied medicine at St Bartholomew's Hospital in London, qualifying as a doctor in 1969. He entered the Royal Navy on a short service commission and completed the Royal Marine Commando course at Lympstone, Devon in 1972. The BMJ noted he initially felt totally defeated by it. His posting with 42 Commando in Belfast during the Troubles, alongside the 3rd Battalion Parachute Regiment, shaped his approach to battlefield medicine in a specific and deliberate way. 2 or 3 times a week he attended post-mortems at the city morgue and photographed what munitions actually do to human tissue. High-velocity rounds, blast injuries, fragmentation. Then used those photographs to train his first aid teams. He called it Doc Jolly's Horror Show. The logic wasn't complex. A man who has never seen a bullet wound does not know how to treat one. He served twice with the Fleet Air Arm, as medical officer in the Dartmouth training ship HMS Bristol and at Britannia Royal Naval College, and took over the Royal Marine Medical Squadron in 1980. By April 1982, as Surgeon Commander, he was officer commanding the medical squadron of the Commando Logistic Regiment Royal Marines, which made him simultaneously the senior medical officer of 3 Commando Brigade, a force of around 5,500 Royal Marines and attached army units. He deployed with his standing formation when it sailed south. He didn't volunteer or request special assignment. This was his job, his unit, his people. During the voyage south on Canberra, he organised first aid instruction for the embarked Marines and paratroopers, running trauma slides that weren't universally appreciated. His original plan had been to use Canberra as a floating primary casualty receiving ship in San Carlos water, passing serious cases to the hospital ship SS Uganda. When Canberra's continued troopship duties made that impossible, he was directed ashore with 90 minutes' notice. The Ajax Bay refrigeration plant was the available option. He took it. The facility the team built inside that building was given a name quickly: the Red and Green Life Machine. The red berets of the paratroopers, the green berets of the Royal Marines. The name came from jolly, and it captured the composition accurately. This was a joint organisation: Royal Navy medical personnel and Royal Marines medics working together, with Royal Marines Band Commando Forces musicians serving as stretcher bearers and medical assistants, and a Royal Navy dental officer running triage at the entrance. What they were working inside was what 30 years of Falklands weather had made of a prefabricated industrial shell. Staff wore Arctic clothing throughout. Hot water came from a single borrowed field kitchen heater, the only source. Surgeons operated by torchlight. Anaesthetic machines were assembled on site and ran on nitrous oxide and oxygen mixture. In the entire campaign across the Ajax Bay system, 420 anaesthetics were administered in 40 continuous days of operating. Jolly's standing order on triage was stated clearly from the first day and restated whenever it needed to be. Casualties would be treated in order of the severity of their wounds. Nationality wasn't a category in that ordering. He articulated the principle whenever it was questioned, and he framed it in exactly the terms that made his own position clear. Under the Geneva Convention and the principles of Hippocrates, he said in interviews, you treat every individual on the merit of their wounds, and not on who they are fighting for and fighting against. When pressed on the specific dilemma, Argentine or British, if you have to choose, his answer was the same each time: whoever needed attention more urgently. The legal foundation was Article 12 of the First Geneva Convention of 1949, which requires that wounded and sick be treated without any adverse distinction founded on nationality or any similar criteria. Britain had ratified that convention. Jolly wasn't inventing a principle, he was enforcing one, clearly, in a building where there was every temptation not to, and where his staff had to make the same call repeatedly, by torchlight, under time pressure, with Argentine aircraft in range of the anchorage outside. There was, as the article later recorded, a little grumbling. There was no breakdown in discipline, no refusal, no documented case of treatment being withheld on grounds of nationality. British troops who had been in contact with Argentine forces that morning lay on the same floor as Argentine soldiers who had been shooting at them. The operating procedure didn't change when the man on the table was wearing a different uniform. The integration went further than triage order. Argentine prisoners of war at Ajax Bay donated blood for their wounded comrades. It was cross-matched using the same method as British donor blood and transfused where group compatible. Men whose country was the enemy were helping keep the enemy's wounded alive. Of roughly 580 total patients treated at Ajax Bay,
The Independent's obituary puts nearly 200 as Argentine soldiers and airmen, on whom 78 operations were performed. The ICRC case study gives a consistent proportion. Approximately 30% of the Advanced Surgical Center's surgical patients were Argentine. The Washington Post's 2018 obituary gives the same figure. The scale wasn't incidental. Jolly's team was running a hospital for both sides in roughly those proportions throughout the 19 days Ajax Bay operated. Some Argentine patients arrived from ground engagements. Teniente Horacio Losito was an officer with Compañía de Comandos 602, an Argentine Special Forces unit, wounded at Top Marlow House on 30th May 1982 during an engagement with British Special Boat Service operators. He arrived at Ajax Bay with serious head wounds and a badly damaged right leg. Jolly retained Losito's surgical documentation. More than 20 years later, in 2004, he wrote formally to the Argentine military attaché in London, Colonel Abel R. Catuzzi, documenting Losito's case and asking what had become of him. Others arrived from the air war. Ricardo Lucero was an Argentine Air Force pilot, shot down while attacking a British vessel. He ejected at the last possible moment and was pulled from the cold water of the South Atlantic with a badly broken knee. Jolly described him in his 2012 Sunday Mirror interview as "my favourite patient." Lucero recovered, returned to the Argentine Air Force and continued flying for years after the war. Jolly learned eventually that Lucero had died around 2009. Not from his Falklands wounds, but in a mid-air collision. A peacetime accident long after the conflict ended. And there were the conscripts, the youngest Argentine soldiers, many barely trained, arriving as prisoners in a British military hospital and expecting something they didn't receive. The JMVH obituary describes those first 3 men Jolly flew to Canberra on 21st of May as having expected torture and finding instead anaesthetic and surgery. That expectation of brutality from a captor is documented not as colour but as a clinical observation. What they found instead was a triage queue and a surgeon who didn't ask where they were from. Jolly, when asked to explain his approach publicly, returned to a particular precedent. Before the Battle of Trafalgar, Nelson wrote a prayer in his cabin on victory. May humanity after victory be the predominant feature in the British fleet. As a naval officer, Jolly took that seriously. He also, in the same 2012 interview, offered something less poetic and more direct. People assume you've got to hate your enemy, but that couldn't be further from the truth. The only people who know what you're going through are the people on the other side. The pressure climax of the hospital's operational existence arrived on 8 June 1982. 2 Royal Fleet Auxiliary landing ships, RFA Sir Galahad and RFA Sir Tristram, were anchored at Port Pleasant, the inlet near Fitzroy on the south coast of East Falkland. Welsh Guards of the 1st Battalion were still aboard Sir Galahad, waiting to be disembarked, when Argentine A4 Skyhawks attacked shortly after midday. Sir Galahad was struck and burned. Sir Tristram was also hit. Dozens were killed in an afternoon, the worst single casualty event for British forces in the war. The survivors presented a clinical problem that was different in kind from the shrapnel and high-velocity wound cases the team had handled since 22nd of May. The fires on Sir Galahad produced burn casualties in numbers and severity the facility had not yet faced. Welsh Guardsman Simon Weston, who would later become one of the most publicly recognised survivors of the war, came off the burning ship with burns covering approximately 46% of his body. Burns can't be definitively treated in a field surgical unit. They require early excision of damaged tissue and resurfacing by skin grafting, procedures that demand a controlled environment, time, and equipment that Ajax Bay didn't have. The team's immediate job was resuscitation, fluid replacement, airway management, intravenous methylprednisolone against smoke inhalation injury, stabilization long enough for helicopter transfer to Uganda. The Galahad incident alone eventually produced 179 casualties taken to Uganda, of whom 83 had burns of varying severity. One attack, 179 casualties from a single ship, through or past Ajax Bay, while the two 400-kilogram bombs in the roof remained exactly where they had come to rest on 27th May. The team worked through the night. Major surgery continued. The dead weren't brought inside. The Advanced Surgical Centre at Ajax Bay closed on 9th June 1982, 19 days after it opened. By then, the team had performed 202 major operations at the facility, with a further 108 at the forward medical stations at Teal Inlet and Fitzroy. More than 650 combat casualties from both sides had passed through the system Ajax Bay anchored. The survival record for British service personnel is stated consistently across the major obituaries and the medical literature. Of the roughly 580 British soldiers and Royal Marines wounded in action who passed through Ajax Bay, 3 died of their wounds. All 3 died on the hospital ship Uganda after transfer, not while under Jolly's direct care at Ajax Bay. The Naval Review obituary states it plainly. No one died of their wounds whilst in Jolly's care. The JRNMS review of his memoir puts it as, every patient who arrived alive at the facility also left alive. The full picture requires one qualification, which Jolly never obscured. Among the nearly 200 Argentine patients treated at Ajax Bay, on whom 78 operations were performed, a small number died of their wounds. The zero mortality formulation is accurate as applied to British service personnel under his direct care. Without that qualification, it overstates. Even qualified, the figure holds in context. In the Second World War, roughly 3% of Allied soldiers wounded in action died of their wounds after reaching a medical facility. In Korea, between 2 and 4%. At Ajax Bay, for British casualties who arrived at any level of medical care alive, the figure was 3 men in roughly 580, approximately half of 1%. Jolly himself attributed part of the outcome to physical preparation. British troops in exceptional fitness, aggressive first aid training during the voyage south, and, his own theory, offered with characteristic directness, the fact that many had donated blood before hostilities, which he believed stimulated the body's self-healing mechanisms. That last point was his clinical hypothesis, not a published finding. The other factors are in the record. When the fighting stopped on 14th June 1982, the formal process of recognition began. In October 1982, the London Gazette published supplement number 49134, the South Atlantic Honours List. Among the entries, Richard Thaddeus Jolly, Royal Navy. He was appointed an officer of the Order of the British Empire, Military Division. His citation covered leadership and gallantry during the conflict. An OBE for the senior medical officer of the most active field hospital in the war was expected. What came next wasn't. Jolly returned to the Royal Navy and continued serving until 1996, retiring with the rank of surgeon captain.
He co-founded the South Atlantic Medal Association, SAMA 82, with former paratrooper Denzel Connick in 1997 and campaigned for formal recognition of post-traumatic stress disorder among Falklands veterans. His memoir, The Red and Green Life Machine, a diary of the Falklands Field Hospital, had been published by Century in April 1983. Diary format, spare, operational, each chapter a day in the field. An expanded version, Doctor for Friend and Foe, appeared in 2012 through Osprey Publishing. In the late 1990s, Jolly compiled a list of Argentine casualties treated by his teams: names, units, diagnoses, surgical records, and sent it to the Argentine Foreign Ministry. The question accompanying it was straightforward. What had become of these men? The list was the first formal indication Buenos Aires had received of the actual scale of British medical treatment of Argentine wounded during the conflict. The ministry set about locating former patients. More than 50 were found and invited to a ceremony. In 1999, 17 years after the war, Jolly stood in the Palacio San Martín in Buenos Aires. Argentine Foreign Minister Guido di Tella invested him as an oficial, an officer, in the Orden de Mayo al Mérito, the Order of May, military merit. The award is conferred on foreigners who distinguish themselves by service or personal achievement, or who have gained the nation's gratitude. More than 50 of the men he had operated on were in the room. He then wrote to Queen Elizabeth II, requesting permission to wear a foreign decoration alongside his British medals. She replied personally, authorizing him to wear the Orden de Mayo on all occasions. He accepted it, he said publicly, on behalf of the approximately 300 British Naval, Royal Marines and Army medics who had served in the war. The Guardian described him as potentially the only military member honoured by both parties. No other candidate has been publicly identified. Both governments proceeded on that understanding. When the British government made Rick Jolly an officer of the Order of the British Empire, that was expected. What wasn't expected came afterwards, when the Argentine government, the government whose conscripts he had pulled from the freezing water and laid on the same floor as British Marines, decided it also owed him a formal acknowledgement and made him an oficial in the Orden de Mayo al Mérito. Two countries that had spent 74 days trying to kill each other's young men agreed on precisely one man, and it was him. He kept both decorations. He wore both decorations. And when veterans from either side came to see him in the years afterwards, they came to the same person. Because, in a disused mutton plant with 2 Argentine bombs in the roof, he had refused, for 19 days, to ask anybody which side they were on. Rick Jolly died on the 13th of January 2018 at his home in Torpoint, Cornwall. He was 71 years old.